Hi, my name is Brittany. I'll be your student nurse today. I'm Ms. Savage. I'm just coming to talk to you about some quality of initiatives that the hospital performs utilizing catheters. Is it okay if I have a seat?
Go ahead.
Alright, and I've done my hand hygiene. So the hospital here has an initiative where they are trying to prevent the infection of catheters, and a catheter is just a small tube that is inserted and it helps the patient pee. Before they place those catheters though, they make sure that the catheter is 100% necessary to help the patient. If it's not necessary, then they don't place them. If they do have to place the catheters, then they make sure that they have clean gloves, hands are clean, the tools that they utilize are sterile, and they come in pre-packaged kits. They're not open, and the staff inserting makes sure that they're not out of date, no holes in them or anything like that. And then once the catheters are placed, they do daily care to make sure that there's no infection introduced during the placement of those catheters, using some clean soap and techniques that the hospital has in place. And they also only do any kind of testing if it's necessary, because you don't want to introduce any possible infections with taking from the catheter. And then they also check on a regular basis if the catheter is still needed. If it's not necessary, then they remove it as soon as possible. All these steps help to decrease the risk of infections, so they could possibly get UTI infections with the catheters. So with all of that, they don't keep the catheters in for more than 48 hours without replacing it. Do you have any questions? Could you tell me a little bit about what we talked about?
There are a lot of steps in place to make sure that no infection gets in the body through the little tube. So they only use clean stuff. There's a lot of techniques and steps to go through when putting the catheters in to make sure that there are no germs getting passed into your body. Shouldn't be in there for more than 48 hours, and they're taken out as soon as possible to decrease that risk for infection.
Yes. Alright. So that is just a little information that we thought you should need. And if you have any questions, just let us know, and we will come and check in a little bit to see if everything's okay. Okay?
Alright.
Alright. So I'll do hand hygiene.